On behalf of the organizers, let me thank you all for taking the time to join us for this unique, important gathering. This event is organized under the leadership of the Global Leaders Network for Women's, Children's, and Adolescents' Health, a very unique Southern-led platform for global health diplomacy, chaired by His Excellency President Cyril Ramaphosa of South Africa, and it's in support of the Every Woman, Every Newborn, Everywhere awareness and child survival action initiatives. This event is titled Maternal, Newborn, Child and Survival, Political Leadership and Evidence-Based Solutions. Let me first start by thanking and recognizing the co-organizers, that is the governments of South Africa and Nigeria, UNICEF, UNFPA, WHO, MPMSCH, Awareness, and CSA, as I mentioned. A very good afternoon to you. I am Tshepiso Makwetla. I'm a journalist, a broadcaster, but most importantly, I am an exemplar for SDG 3.1 and 3.2. I was fortunate enough to survive a near maternal death after a fresh stillborn due to a completely preventable death. So it is truly an honor and a privilege to stand here and be given the task to steer this conversation, which you will hear from various speakers. Why at this crucial period of funding resource constraints, particularly in the global south, which is most affected, how the partnership between the GLN and WHO is a much needed impetus to saving lives through evidence and science-based interventions. And I'd just like to say for myself that the world is changing so much that we've become so adaptable to these new normals. I hope that I'm in a room of people who will loudly and proudly say that we will never accept what we will call a new normal of parents burying their children, of children having children and dying as a result thereof. Can I get a resounding yes, never, never again? For a minute there, I was about to faint because it looked like nobody was responding. So I'm glad to hear that. So let's start with this short video to get a deeper context on who, what, how, now, and why. So let's cast our eyes to our monitors and then we'll see. So this is what I was saying. I hope I will hear a resounding commitment from you to say, not on our watch. As you can see, the past few months have been very sobering with intensified crises and geopolitical shifts, particularly when we look at this pivotal moment. It is with the understanding that donor funding cuts are threatening to reverse years of progress in maternal, newborn, and child survival. We've been hearing about how the changes come to bring about opportunities. But today, the questions that we really are asking you, and we must ask of ourselves, is what concrete action will we take to make a difference for every woman, every child to not only survive, but thrive? We will hear from our various speakers the latest data and trends on maternal, newborn, and child survival. We'll also glean from leaders and champions what they're doing to sustain, if not accelerate, progress. Young people will share their perspectives and advice, including a call to action, and I have no doubt that we will be hearing the reverberating echo of this is a moment to be bold, and this is a moment to not hold back. So we'll start with interventions from UNICEF through its executive director. We're going to ask Catherine Russell, UNICEF Executive Director, to come up. She will also be joined by later on the Executive Deputy Director for Management of UNFPA, Andrew Saberton. Let me introduce our first guest. Ms. Russell has served as an assistant to President Biden and has served as an ambassador at large for global women's issues as the US Department of State, where she integrated women's foreign policy in more than 45 countries. So she's worked in partnership and other government, multilateral organizations and civil society movements. She'll reflect on the state of WICA, women, children, and adolescent health, including maternal and newborn and child survival in 2025. Please give her a warm round of applause.
Excellencies, colleagues, partners, friends, it's really nice to be here. Good afternoon, and thank you so much for being here and for listening to all of us talk about this incredibly important issue. We gather at a quite pivotal moment, a moment to reaffirm our shared commitment. I think I agree with you 100%. We need to do that, and we need to do it loudly. That no mother and no child should die from causes we have the power to prevent. I say this all the time at UNICEF. There are so many terrible things that happen to children every day all around the world. But the things that we can prevent, we really need to do better and make sure that children aren't dying from things that we know how to deal with. Since 2000, we've made remarkable progress on improving maternal, newborn, and child survival outcomes. The number of children under the age of 5 dying each year has been halved. It's a huge accomplishment. Maternal deaths have fallen by 40%. These are not just numbers. They represent millions of mothers watching their babies take their first steps, millions of children growing up, going to school, and living full, healthy lives. These gains are thanks to the dedication of frontline health workers, the resilience of parents, the support of governments, civil society, and the enduring solidarity of the international community. But progress is slowing, and in some places it is at risk of slipping away. Today, a child born in sub-Saharan Africa is 18 times more likely to die before their 5th birthday than one born in Australia or New Zealand. Children born in conflict-affected settings are 3 times more likely to die than their peers in peaceful countries. These disparities are not just statistics, they are injustices. Right now, preventable deaths continue to steal the futures of children whose only misfortune is to be born into poverty, into conflict, or into crisis. Climate change is compounding these threats. Health systems are under strain, and global funding cuts are endangering the most basic life-saving services. This is not the future we promised children when we adopted the Sustainable Development Goals. It's not the world envisioned by the Convention on the Rights of the Child. We must do better. The good news is that we do know what works. We have the tools, we have the knowledge, we have affordable, proven solutions to protect health and well-being of mothers and children, from pregnancy through birth and through the most vulnerable early years of life. These tools include empowering midwives, nurses, and community health workers, expanding access to essential services at the community and primary healthcare level, preventing and treating malnutrition, pneumonia, malaria, and diarrhea, which, as you all know, are the top killers of young children, reaching every child with vaccines. Immunization alone has saved 154 million lives over the past 50 years. Yet too many children are still missing out, left behind and at risk. Excellency, the solutions here are clear. The question is, do we have the will to act? Today, UNICEF is calling on governments and partners to take urgent action. First, invest in high-impact frontline health interventions with a focus on human resources for health and on reaching the most vulnerable. We must not allow diseases like measles and polio to continue robbing children of their futures when we have the tools to stop them. Second, protect and increase international investment in essential health and nutrition services, particularly in fragile and conflict-affected settings, where the needs are highest and domestic capacity is the lowest. And third, we urge strong national leadership to turn global commitments into real local impacts, including through the implementation of the World Health Assembly 77 resolution, the Every Woman, Every Newborn, Everywhere initiative, and national child survival action plans. The path forward is clear. Now we need bold, collective, and sustained action. Together, let us recommit to a world where no child dies from a cause we can prevent, and where every mother survives childbirth. A world where every child, everywhere, has a chance not only to survive, but to thrive. Thank you all very much.
Thank you very much, Ms. Russell. And I do believe that the ED of UNICEF, although glad to be with us, has other commitments. So please do release her. And I want to echo your sentiments that we have made progress, but we need to do better. That these are not just figures, they're not statistics. This is your brother, this is your niece, this is your nephew. This is a member of your community. We used to talk about 6 degrees of separation. Well, now we're talking about 1 in every. We're talking figures of in every 2. So it's getting closer and closer. We recently observed International Nelson Mandela Day. Utata Nelson Mandela, a real leader, used to say that every issue, no matter how serious, no matter how sensitive, no matter how contentious, that we need to ensure that at the end of it, at the end of debate, we need to emerge stronger, more united than ever before. And I hope that we will emerge out of this more committed than before. Now, for a high-level address on the realities and opportunities, allow me to welcome and introduce to you the UNFPA Deputy Executive Director for Management, Andrew Saberton. Mr. Saberton primarily oversees UNFPA's engagement in UN reform, its humanitarian response, fiduciary matters, human resources, information technology, supply chain management, and the prevention of sexual exploitation and abuse. Please give him a warm round of applause as he gives us his offering on this.
Excellencies, distinguished guests, partners and colleagues, and dear young people. It is a privilege to address you at this high-level HLPF side event, which aims to accelerate our collective progress on maternal, newborn, and child survival. I thank UNICEF's Executive Director, Catherine Russell, for her remarks. UNICEF and UNFPA are close partners on this very important mandate. Protecting the lives of women, babies, and children has never been more urgent. Many women face preventable risks to their health and safety during pregnancy and childbirth, and putting them and their offspring in jeopardy. The numbers are particularly staggering in sub-Saharan Africa, where 70% of the global maternal deaths occurred in 2020. And where a woman is 130 times more likely to die from pregnancy complications than in Europe or North America. These numbers are just not statistics. They represent a profound injustice, and they remind us why our tireless efforts on this issue matter. This year's SDG report notes real and substantial development gains over the past decade, with notable improvements in maternal and child health. Yet the report also reveals that progress is slowing after decades of gains, as the maternal mortality ratio in low-income countries remains dramatically higher than in other countries. We can accomplish so much when the world galvanizes to protect women and children. The reduction of maternal deaths since the MDG era began in the year 2000 is a testament to global solidarity and political will. Investments in health systems have made a difference. In 44 countries that UNFPA supports through the Maternal and Newborn Health Fund, maternal deaths have declined 40% since 2010, compared to 22% globally. This progress stems from our high-impact policies, innovations and investments, including in the access to quality maternal and newborn commodities and in midwifery models of care. At UNFPA, we often say that midwives are the backbone of maternal health. In fact, skilled midwives can deliver 90% of essential maternal and newborn health services, and yet still the world faces a shortage of nearly 1 million midwives. To bridge this gap, UNFPA, UNICEF, WHO, and JPIGO launched the Midwifery Accelerator, a global initiative that brings countries and funders together to invest in the midwifery profession. Our collective aim is to drive sustained improvements in maternal and newborn survival rates. HLPF is an important moment for honest conversations about the state of global health, including sexual and reproductive health and rights. It's an opportunity to reset the narrative and accelerate actions on all levels. We need all hands on deck, every ministry, every sector, and every stakeholder, to ensure that maternal, child, and newborn health remains a high priority on the global political agenda. In our fragmented world, it will take a united front to move the needle equitably. And at this esteemed forum, I ask member states to prioritise sexual and reproductive health services for women and girls under the banner of universal health coverage, to invest in proven and cost-effective solutions to strengthen health systems, including midwifery-led care, to ensure access to essential maternal and newborn medicines through stronger regulation and supply chains, and to mobilise more domestic and global financing for maternal, newborn and child health in settings where they are most needed. Now is the time to wield our collective power to uphold women's rights, build resilient health systems, and dismantle the inequities driving maternal, newborn, and child deaths. It is the time for the courageous leadership and decisive action needed to shape a brighter future. We are at a turning point, and the lives of millions depend on our resolve. And let history remember us for rising to that challenge and delivering on our shared commitment to health, dignity, and justice for all. Thank you.
Thank you so much for that, Mr. Sableton. And as you say, it's about collective effort. And I am confident that I'm in a room of people who believe that and understand that sometimes it takes a small group of people, a committed group of people who will ensure that we will not only reduce, but at some point bring an end to maternal newborn child mortality and save more lives. And it's exciting to hear about the progress made in the midwifery accelerator that you speak about, because some of the things that we know work, we have scaled back on because of science. But science and innovation works with the institutional knowledge that we have, the indigenous knowledge systems that we have to save lives. So it is now an absolute pleasure for me to introduce the keynote remarks from Her Excellency Ms. Matu Joyini, Permanent Representative of South Africa to the UN. Her Excellency is an accomplished career diplomat who also has extensive experience in mining, finance, petroleum, and consulting through various positions held in private sector industries. She shares her reflections on national progress, particularly political strategies and the inter-country solidarity under the Global Leaders Network. Your Excellency, I'm personally excited, looking forward to learn from your perspectives in light of the initiative that South Africa is leading, the Global Leaders Network, bringing together the highest level of political leadership to elevate the agenda of women, children, and adolescents' health and foster a cross-country collaboration and solidarity. I recall yesterday your sentiments that you echoed. You said, it seems impossible until it's done. So please give her a warm round of applause.
Thank you, Tsepiso, and it's really good to see you here at the UN. Distinguished delegates, excellencies, dear colleagues and friends, good afternoon. I am honored to join you today as we affirm our collective commitment, as Tsepiso has made us to do it over and over, that commitment to the health and well-being of women, children, adolescents across the globe. We wish to thank the Partnership for Maternal, Newborn and Child Health for anchoring this effort through the Global Leaders Network Secretariat. And we express our sincere appreciation to Nigeria, our fellow GLN member, for co-hosting this important forum. Women, children, and adolescents from the core of our society, they represent nearly 70% of the world's population. They are future leaders and the backbone of sustainable development. Yet, despite their immense value, we are witnessing a disturbing decline in political will and investment in their health and well-being. This is precisely why South Africa is proud to serve as a chair of the Global Leaders Network for women's, children's, and adolescents' health. It is a role we take on with deep resolve and purpose. Together with 11 dedicated member states, we are united in amplifying the voices of women, children, and adolescents in every corner of the world, ensuring they remain at the core in political and development discourse. South Africa is fortunate to have its constitution that guarantees access to healthcare for pregnant women and children. It affirms the right of every woman to make informed choices about her body, such as if and when to have a child, in accordance with the Maputo. We boldly stand up for the right to access to safe abortions. As a country, our experience has shown us that safe abortions save lives, protects women and young girls from gender-based violence, and prevents catastrophic financial exposure for women, men, and households. We have made some notable progress in advancing the health of women, children, and adolescents specifically. We have focused on maternal mortality, and that has declined due to the expanded access to prenatal and postnatal services in hospitals and in communities. We have introduced dedicated maternal health services in hospitals and in community settings that have been pivotal in providing prenatal and postnatal care. Child health has improved with reductions in under 5 mortality driven by enhanced vaccination programs, better nutrition, and access to healthcare services. For adolescents, they have benefited from comprehensive sexuality education programs and programs on mental health and substance abuse. The government has made strides in ensuring access to family planning and reproductive health services with the integration of reproductive health services into primary health care. And in the face of South Africa's high rates of gender-based violence, we have intensified efforts through programs designed to support victims and educate communities. We are also investing in community-based outreach programs that have increased awareness about women's, children's, and adolescents' health rights and available services. Despite progress, though, significant disparities remain in health outcomes, particularly between urban and rural areas, as well as among different socio-economic groups. These inequities hinder access to essential services, health services for marginalized population. The health system has faced challenges exacerbated by the COVID-19 pandemic, which disrupted healthcare service delivery and exacerbated existing health disparities. And in the face of this, investments are essential to overcome existing challenges and ensure equitable health outcomes for all populations. In addition, continuous collaboration among government, civil society, and the private sector will be vital in sustaining and expanding these health initiatives moving forward. We call on all regional mechanisms to prioritize women's, children's, and adolescents' health in their agendas. As Africans, we issue a special clarion call to the AU to add women's, children's, and adolescents' health as a standing agenda item. Our future prosperity depends on the sustained political attention we give to those who carry, nurture, and shape the next generation. And let this gathering be a turning point, a reaffirmation of leadership, solidarity, and an unwavering commitment to those whose lives and dreams depend on the decisions we make today.
And that is the value of being led by people who not only have the lived experiences, but connect with the very issues at hand and are willing and committed to fighting for it. Thank you very much to South Africa's permanent representative to the UN Ambassador, Joyini. Thank you very much. And I would like to now ask the following ambassadors, champions to come and join me on stage. And let me just first call them up before I make excuses, not for myself, but Save the Children child advocate Vela Gray is going to join us to share her experiences, make her call to action. If I could please ask her to come up on stage. Danta Zara, UN Youth Ambassador, is also going to speak to us about how she is moving along with her colleagues to change policy, to drive advocacy. And because they are joined in arms and passion, I'd like to also ask the UNICEF Regional Ambassador for Eastern Southern Africa, Tendai Bis Mtawarira, to please come and join us here on stage. Just as an aside, look at this picture. Wouldn't you just feel safe? I'm just saying, wouldn't you need this guy fighting in your corner, whatever adversaries you are facing? It is a pleasure to have you all here. You know, when I was listening to you, PR, just speak about what we face in South Africa, I just remember that there was so much excitement when we're transitioning from the MDGs to the SDGs, and we're saying we're going to do better. It's very sad to see how we're regressing on some of the major commitments that we have made when we look at access to not only primary healthcare, but sexual and reproductive health rights. And Vela Great, I know that you are a very busy woman, so allow me to say to our audience here today that it's not out of lack of commitment, but you do have to leave us. She's flying off to make another intervention in Japan. I'd like to, without waiting too long, to please call upon Vela Great Mashele, Save the Children child advocate. So we're going to hear about how the youth advocates, the community health workers, their firsthand testimonies of their lived experiences. And as we've been speaking about, amidst the deepening aid cuts, the rising health inequalities, the leadership of youth and civil society has never been more vital. And you'll hear from them what they're doing as a frontline defense in preventing maternal newborn child deaths and ensuring that, as we say, children not only survive but strive. Please give her a warm round of applause. Vela Great.
Good afternoon, everybody. Firstly, I would love to thank you very much for this opportunity that you have given me today. My name is Bella Great. I'm a 17-year-old from South Africa. I'm a climate change activist and a child human rights defender from Save the Children South Africa. So today my remarks will be based a lot on adolescent health in South Africa. But I want to start by asking you this question. Did you know that children under the age of 18 account approximately 30% of South Africa's population, right? That's such a big number. And this number reveals the urgent need to allocate more funding to children's health, education, protection, and overall well-being. So last year at Save the Children South Africa, what we did was that we facilitated a child-led voluntary national reviews on 6 priority SDG goals. And one of the SDG goals that we reviewed was SDG goal 3 on good health and well-being, right? And the children highlighted some progress, noting now that they were able to access primary healthcare, like healthcare is free. I can just go to the clinic and get my contraception if I want, or then I can just go there if I have flu, right? And they also noted efforts towards education on HIV and AIDS. As you know, that our country has one of the highest statistics for HIV and AIDS, right? However, despite this progress that we are seeing, we highlighted some challenges within the healthcare system, such as patients visiting multiple clinic or hospitals, collecting medicine and then selling them for their own personal gain, which has led and which leads to medicine shortages for patients who really need the medicine. For example, I live in a township in South Africa called Alexander, and I think we have over 5 clinics. And a person might visit River Park Clinic or East Bank Clinic, or just to name a few, to collect medicine and to sell. And what they're now straining the country's healthcare system, right? And the children suggested that we need innovative solutions to tackle this issue, such as there should be a collaboration between clinics and hospitals so that they can share information so that they can prevent this. And they suggested that we need to go digital to track patients' medication history. And the children also believe that by working together and leveraging technology, we can find effective solutions for these challenges, right? So the children's report also highlighted that preventable deaths are caused by lack of to access medication and overcrowding in hospital. So I have a friend personally who I went with her to the hospital 3 times, and we went there looking for medication, and they told us that the medication is not there, it's actually finished. And the first time they told us, come back next week, we went back next week, and then they're like, no, come back again and again. It's just that I never followed up, because then we started writing examination. Okay, we need to ask ourselves, imagine if she was seriously sick, then what could have happened? Then in that case, we would have had her dying. And this also shows that some of the deaths could have been prevented, but because we have corruption within the system, then people are dying unnecessarily. So we also highlighted in our report that we also have a problem of migrants in our country. And the problem is that then the government has not properly planned for this population. So then they go to hospitals and they take medicine for people who the government actually planned this medication for, which strains our system. So then as the children, what we called for better border protection, so that the resources, the education system, the healthcare system is not strained by undocumented individuals. And furthermore, what we emphasize is that a lot of young people are struggling with mental health. Particularly, this is happening amongst my schoolmates. A lot of people are actually depressed. And then we also emphasize that this is not given enough attention. It is not spoken about enough, and it is not supported adequately. And there is a lack of awareness. And we also highlighted that right now we have a rising number of teenage pregnancy in our country, and that these teenage mothers face a lot of mental health challenges, and without support, these challenges can become more overwhelming, making it hard for them to care for themselves and their babies. So we the children recommend that we recommend that the existing facilities should be improved, and we should ensure that they have adequate electricity and water, so they can be able to serve the community efficiently. And we the children, my closing statement is that we, the children, from our report, believe that with continued investment, accountability, and listening to what children are saying, we can create a health system that supports every child, no matter where they live or where they are. Thank you so much for your time.
Thank you very much, Vela, for that impassioned plea, and we certainly will stand by you. All the best as you continue to your next assignment. But we continue with the offerings from the youth ambassadors, the advocates. Up next, we hear from Gunther Zara, who is a UN Youth Ambassador to the Advisory Council, where she engages not only young people as equal partners in peace, human rights, and sustainable development, but also those who are steering policy development and implementation. She's also a medical student in Iran, grounding her health policy work in clinical expertise. Please welcome her to the stage with a warm round of applause.
Good evening, everyone. I think it's good afternoon. Now, I can read from the PDF that I written earlier, but I want to talk to you from the bottom of my heart because I come from a country that is drastically affected in terms of health sector. I come from Iraq. Now, when I talk about Iraq, I talk about women issues because I'm a woman myself. Let me just introduce you to some really simple, intuitive points. In Iraq, despite the fact that we don't have like a good health infrastructure, we have problem with access when we build a good infrastructure. For example, when we build a hospital, it is still far away from a certain village that middle income and low income families can't afford the transportation to. My niece had a fit and she reached the hospital, which was 45 minutes away from her. She succeeded in getting well. She did get well, but the problem is, what if this fit was strong enough to cause her lifelong problems? So the second thing is midwives. In the South, midwives have very weird traditions. Guess what? When a baby is born, they put sheep wool in their belly button. Can anyone guess what happens next? Tetanus. Tetanus. Just imagine. They get tetanus even before getting vaccinated, and I'm sure you can imagine what happens next. Babies die just because of simple, let me say, silly traditions that we got from people who did not know anything about medicine. Another point is that women are not aware of the risk factors that that make them go to hospitals for evaluation and hospital admission. We women are fighters. We should be proud of this. We think that our illness is not very critical, is not very, advanced. So we don't have to go to hospital. We sacrifice the money that we have for others. We save it for our children, for our other family members, and for the sake of what? For the sake of always giving what's best for my family and forgetting myself. But let me just make a point. If the mother in a family is not well, how is she gonna make her children well? How is she gonna breastfeed them? How is she going to get them ready in the morning for school? Now, in Iraq, there is FGM, which is female genital mutilation. However, the percentage is decreasing. It was around 7%. It is decreasing, thankfully, but we still have certain countries in the Middle East, such as Somalia, Somalia is in Africa, such as Egypt, that have very high female genital mutilation percentage. Let me just shed some light on the initiatives that took place in Iraq to aid vulnerable communities, especially children and women. First of all, the NDC document, Nationally Determined Contributions, the first draft did not have any statement or word or description related to children and youth. Today, however, the NDC is being revised and reformed, and I'm proud to be one of the youth authors, and I'm going to have my name on it, and that's a proof that Iraq is developing. I know it's a slow process, but we are getting there. We need a long way to get there, but we're getting there. Thank you so much.
I really wish we had more time, but unfortunately there is just so many diaries that are at play in this room. So without further ado, let's take a quick look at our next intervention from Burkina Faso. UNICEF Youth Advocate Sandrine is going to tell us about what efforts she's made, including her community, children and adolescents, to end newborn and maternal deaths in Burkina Faso.
Bonjour, je m'appelle Sandrine, j'ai 23 ans et je suis youth reporter au Burkina Faso. Dans ma communauté, la santé des mères et des enfants est un défi. Mais avec l'UNICEF, nous faisons changer les choses. Au Burkina Faso, l'accès à des soins de santé reste un défi pour de nombreuses mères et les enfants. Certaines femmes parcourent de longues distances pour atteindre un centre de santé. Et beaucoup d'enfants ne bénéficient pas de services essentiels pour bien grandir. La situation est difficile, mais nous continuons à nous battre pour que chaque mère et chaque enfant reçoivent les soins qu'ils méritent. En tant que Youth Reporter, je travaille avec l'UNICEF pour partager des informations sur la santé maternelle et infantile. Nous organisons des discussions communautaires pour informer les familles sur la nutrition, les vaccins et les accouchements sécurisés. J'utilise aussi mon téléphone pour recueillir les avis des jeunes afin que eux aussi les voix soient entendues par les décideurs. Grâce à notre travail avec l'UNICEF, plus de mères se rendent dans les centres de santé et plus d'enfants ont accès aux services essentiels de santé. Les gouvernements et les décideurs doivent continuer à investir dans la santé maternelle et infantile, car chaque mère et chaque enfant mérite une chance de vivre en bonne santé. Les jeunes comme moi doivent être impliqués, car nous connaissons nos communautés et nous pouvons inspirer les autres à agir, parce que nos voix comptent. S'il y a quelque chose que je veux que vous reteniez, c'est ceci. Investir dans les mères et les enfants, c'est investir dans l'avenir. Soutenez-nous et ensemble, nous construirons des communautés plus saines.
Thanks, Sandrine, for her contribution and the rest of the youth advocates. Thank you very much to Ganta Zara, UN Youth Ambassador, as well as Save the Children Child Advocate, Velograde Mashele. The permanent representative to the UN from South Africa, Ambassador Joyini, did mention that we are collaborating, co-hosting this event with Nigeria. Let me again acknowledge Ambassador Bola Asaju, as we're going to bring perspectives now that showcase successes and challenges from other country members. And this time we look to Nigeria. We're going to amplify the importance of evidence and scientific-based interventions. So allow me to point you again to the video monitor so you can hear the remarks from Honorable Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare of Nigeria. Is going to be delivered by Dr. Muyiwa Aina, the Executive Director of National Primary Healthcare Development Agency. Please cast your eyes there to the video.
Your Excellencies, distinguished delegates, ladies and gentlemen, my name is Dr. Muyi Aina, the Chief Executive of Nigeria's National Primary Healthcare Development Agency. I am speaking on behalf of my Minister, Professor Mohammed Ali Pate, Honorable Coordinating Minister for Health and Social Welfare, who extends his apologies for not being able to do this in person, as he is tied down by very important national events happening this week and last week. I want to start by thanking the Global Leaders Network for Women's, Children's, and Adolescents' Health, as well as all of the partners, WHO, UNICEF, UNFPA, and PNHCH, as well as Every Woman, Every Newborn, Everywhere, and the Child Survival Action Initiatives for convening this very important side event on the sidelines of the HLPF. I thank His Excellency, President Cyril Ramaphosa of South Africa, the chair of GLN, for really pioneering the GLN. I also thank my own president, His Excellency Bola Ahmed Tinubu, GCFR, for joining hands with other heads of state to really enable this Southern-led global health initiative that champions the health and rights of women, children, and adolescents. We meet at a time when far too many women and children die from preventable causes. By the time I finish speaking, at least 2 women will have died from pregnancy or childbirth. In 2023 alone, about 4.8 million children died before they reached the age of 5. This is unacceptable. My country, Nigeria, unfortunately contributes a significant share of these deaths, with unacceptably high under 5 and maternal mortality rates. Even though we have made progress in the last 2 decades in reducing maternal and child health, we have seen some stalling in recent years, and in some cases even reversal. Many countries will struggle to meet the SDG targets for women and children by 2030. No woman should die while giving birth, and no child should be left to die from preventable causes. At the 77th World Health Assembly, Nigeria co-sponsored the landmark resolution on maternal, newborn, and child health. And central to this resolution is increased investment in primary health care as a platform to achieving universal health coverage and sustainable healthcare financing. In December of 2023, President Tinubu signed a compact with the 36+1 subnational governments, as well as the partners and key stakeholders, and launched the Nigeria Health Sector Renewal Investment Initiative, which really positions primary healthcare as the vehicle for achieving UHC. He set ambitious targets for us, which is to reduce maternal mortality and infant mortality by at least 20% and 15% respectively in the 4 years leading up to 2027. These targets are pursued primarily through our flagship Maternal and Newborn Mortality Reduction Innovation Initiative, through which we have enrolled over 400,000 pregnant women in the first 6 states and have started and link them to functional primary health care, where they are receiving protocol-guided, high-quality antenatal and delivery services. MANE also makes provisions for emergency transport, essential commodities, and free emergency cesarean sections, as well as health insurance, capacity building, and surveillance in high-burden areas. Other key initiatives that are contributing to achieving our target includes the training of frontline health workers. We have upskilled over 60,000 midwives, nurses, and community health workers in our PHCs as part of a 120,000 target that our president has set for us. We are also revitalizing our primary health centers with the goal of having 17,000 plus fully functional facilities by 2027. In addition, to protect our adolescents, we have vaccinated over 14 million girls with the HPV vaccine since October 2023, where we launched the vaccine targeting girls aged 9 to 14 years. However, let us be clear, resolutions are not enough. We must fund what we commit to. Today, we are facing a crisis in health financing. Recent cuts in development assistance for health have significantly impacted the delivery of services and disrupted supply chains in many instances and in some countries. There is a projected decline of 51% from 80 billion in 2021 to 39 billion in 2025 in ODA, and this is causing significant gaps in health funding in many countries. Countries, including Nigeria, are making tough choices to prioritize health in already constrained domestic budgets. President Tinubu's government prioritizes healthcare financing and is implementing reforms to increase the fiscal space for health. It's increasing government allocation to health, improving tax collection, introducing innovative financing mechanisms, as well as reforms that are aimed at improving health effectiveness of spend in the health sector. This is, again, alongside implementation of the National Health Insurance Authority Act and the Basic Healthcare Provision Fund, which really serves to finance healthcare for the vulnerable amongst our population. At the global level, Nigeria sponsored the resolution on strengthening health financing earlier this year. Across the world, many women and children cannot access safe, effective, and affordable essential health supplies in communities like antibiotics and oxytocins when they need it. This is due to inequities and weaknesses in market and procurement systems, fragmented supply chains, as well as a lack of pooled procurement power. This is an emergency and must be addressed, cannot be allowed to continue. Nigeria is tackling this through the Presidential Initiative for Unlocking Healthcare Value Chain, which is working to increase local production of essential commodities to about 70% by 2030. This will also reposition Nigeria as a regional hub for food procurement in the African region. As we reflect on the SDGs, particularly SDG 3, we must commit to the core values that inspire them, values of equity, dignity, and justice. We must protect and increase investments in high-impact interventions for women, children, and adults. We have to work together across sectors with the highest level of political leadership and collaborative advocacy and action with civil society and communities. We must act with urgency so that no woman or child is left behind, not because of where they live and not because of what they feel. Together we can save lives, together we must. It is on our watch. Thank you.
And that is a very important intervention from a GLN partner, Nigeria, on what they're doing. As we are wrapping up the event, I'm going to ask the Executive Director of PMNCH, Rajat Khosla, to please draw nearer. And I'm going to introduce you as we continue with the Ambassador Youth Advocate interventions. Before we do that, very quickly, and I know the organizers are probably gnashing their teeth at me, but I think it's an important exercise to do. Raise your hands if you know anybody who has died as a result of maternal death. Please raise them higher. Raise your hands if you know somebody who's lost a child or a newborn as a result of preventable deaths. Please raise your hands. Those of you who raised your hands before, please raise your hand and have a look around the room. I think it's important. Please have a look around the room so that you can see when we talk about every woman, every child, everywhere, what we're talking about, that it's happening to me, it's happening to you, it's happening to your loved ones. So I truly am honored. It's a privilege to introduce the UNICEF Regional Ambassador for Eastern and Southern Africa, Tendai Beast Ntawarira, a beast on the rugby field. He also lends his strength and prowess to fighting inequality and injustice. As I mentioned earlier on, who wouldn't want to have this guy, fondly known as the Beast, by his side, her side? He is a well-known Zimbabwean South African retired professional rugby player. He played for the South African national team. He now runs his own foundation, the Beast Foundation, in support of children and youth. So he was appointed UNICEF Regional Ambassador in 2022, and he continues to use his voice to bring much needed attention to UNICEF's humanitarian and developmental priorities in the region. Please give him a warm round of applause.
Thank you so much, Tabisa, for that wonderful introduction. Good afternoon to you all. It's a very important conversation we're having here today, and much needed at this time. I'm honored to be here, not just as a retired professional rugby player and UNICEF Regional Ambassador, but as a father, a husband, a businessman, a philanthropist, and a lifelong believer in the power of human potential. But before I was any of these things, before I lifted the wonderful William Webb Ellis Trophy, which is the Rugby World Cup, before I ever wore a rugby jersey, and before I even stood up in front of people and gave a speech, I was just a being in my mother's belly, a fetus, a cell destined to become a fully fledged human being. I was breastfed at 5.5 kgs of birth. My mom went through a lot. So I could be nourished through the milk I received and protected from deadly diseases. I was raised by parents who sacrificed everything to give me a great education, to feed not just my body, but my mind. And before I became a man capable of leading a family, I was a boy shaped by my environment. I needed clean air to breathe, mineral-rich water to drink, and nutritional food to fuel the athlete I'll become one day. Today, I paint this picture to show what it takes to produce a beast, not just in sport, but in life. In the world of multilateralism, we call these building blocks the Sustainable Development Goals, the SDGs. I'm proud to stand among you, leaders, academics, civil society, policymakers, donors, and global health champions. The decisions you make and the actions that you take, they matter. And they've already made the world a better place. But here's what I've learned. The SDGs are not just a business for the governments or NGOs. They're an entire society venture. They belong in the home, in schools, in the workplace, on the sports field, and everywhere we touch lives. Today, I want to speak as well directly to the private sector, to the business community. I ask you to step up and ramp up your partnerships with governments and institutions in pursuit of the SDGs. Because while development assistance is on the decline, is being cut, military budgets are on the rise. If we're not careful, the SDGs, especially those focused on women, children, and adolescents, may drift even further out of reach. And that, my friends, is a risk we cannot afford to take. Failure to invest in these groups is not just a moral failure, it is an economic disaster. McKinsey tells us if we don't close the women's health gap, we could lose $1 trillion from the global economy. The Lancet warns, failing to invest in early childhood care could cost 8 to 19 times in the long run. And the Partnerships for Maternal, Newborn, and Child Health reports ignoring adolescent well-being could cost us a staggering $110 trillion between now and 2050. So yes, we understand the risks, and yet the investment is declining, and that should be concerning to us all. So today, with all humility, I lift my voice. I aid my voice to this worthy cause and call on my colleagues in the business world. Because as leaders, we hold influence, reach, and resources, and we need to use them for good. Let's make a collective commitment to the health and well-being of women, children, and adolescents. Not just because it's the right thing to do, but it's smart business. Here's how we do it. Number one, prioritize health in corporate strategy. Make women's, children's, and adolescents' health a part of your business model. Invest in products and services that promote nutrition, mental health, and access to care. Number two, implement family-friendly workplace policies. Create environments that support working parents. Parental leave, healthcare, and flexibility build stronger and more loyal teams. Number three, foster public-private partnerships. Work with governments, NGOs, and local leaders. We can only achieve so much greater when we join hands. Number four, invest in health education. Use your platforms to raise awareness about reproductive health, mental well-being, and nutrition. Knowledge changes lives. Number five, advocate for gender equality. Empower women in your organization, because when women thrive, entire economies rise. Number six, measure and report impact. Track your contributions to health outcomes, share your results, and inspire others to follow. Last but not least, number seven, mobilize resources where they are needed most. Invest in underserved areas. Bring innovation to where it matters most. Your capital can spark generational change. My story reminds me of this profound truth. Economies aren't just built in the boardrooms. They're built by mothers determined to raise nations. Children poring over books by candlelight. Adolescents dreaming big in small villages. Youth who build clean, grow, and power communities. And by women who reinvest 90% of their income into their families compared to just 35% for men. Recognizing this, we must become decisive, action-oriented allies. Allies to women, allies to children, and allies to adolescents. And I ask you, my plea, to join me or join us, commit to this vital cause, so that together we can build a better world where every human being has the opportunity to live a healthy, dignified, and prosperous life. Thank you.
Thank you very much, Beast. Would you dare disagree with this guy? His call to action, I would say not. And to close or conclude this very special event, I'd like to invite Mr. Rajat Khosla, Executive Director of the Partnership for Maternal, Newborn and Child Health, PMNCH, the world's largest alliance working on women's, children's, and adolescents' health, which is, by the way, 20 years today. I think they deserve a warm round of applause for that. And he will conclude today's event. Mr. Khosla.
Thank you for that, Sipso. And not only we are 20 years old this year, but today we also launched our own new strategy for the next 5 years. So really a defining day and year for us. I could actually just conclude by saying everything he said, and let us all be. But Excellencies, colleagues, dear friends, what an honor it has been to hear to this distinguished round of speakers and extraordinary series of interventions that we have heard, data that has been narrated, and lived realities that have been told to us. There has been a lot that we talked about. The data is indeed stunning. And as we heard, and just to recap, 4.8 million children and newborns died last year of preventable causes, 1.9 million stillbirths in the same year, 260,000 women lose their lives every year of preventable causes. In any other circumstances, these amounts of preventable deaths will be a cry for an emergency to be declared. That we are looking at what's happening and what's not happening and what do we do about it. But yet we don't. We narrate this data and we keep on living as normal. As somebody said at the start of this conversation, this cannot be business as usual. There are 4 or 5 issues that came across different presentations that I just wanted to signpost as we leave this room and the conversation we have today. The first is about political leadership and ownership. We have to elevate maternal, newborn, and child survival to the highest level of political priority. And the Global Leaders Network is one such example of how we can continue to do that. And my sincere thanks to the government of South Africa and His Excellency President Ramaphosa for shepherding this initiative. The second is financing and sustainability. Of course, we are battling very draconian aid cuts and trying to figure out what we do. But let's be clear, the shrinking fiscal space that we are confronted with is also about how we prioritize our domestic resources on these issues. And time is now to look at investment in women, children, and adolescents. That's all that wonderful data that Beast just recapped for us as a matter of national priority. Data, accountability, and results needs to be cornerstone of what we do. We really cannot improve what we do not measure. It is a matter of political will. And what measures really does get done, but is it that we are not measuring because we don't see these lives worth saving anymore? People-centered solutions and inclusion, the interventions from young people that we heard today are very telling of what we need to do and where we need to prioritize our focus and resources towards. So as we do look at the future and as we recommit the partnership for the years to come, there are collective calls of action. And again, I'm just, taking more time without just saying whatever Beast said, let's just do that. But, the 4 things that stood out for me, the first is reaffirm survival as a global development priority. Next is to support the scale up of the Every Woman, Every Newborn, Everywhere and Child Survival Action Target commitments. These are not just bureaucratic formalities I'm talking about. These are real plans for acceleration and reduction of mortality. Drive accountability and cross-sectoral accountability that must be held to the core of our commitments and champion voices of women, youth, and communities. Colleagues, let's be clear, preventable deaths of women, children, newborns are not inevitable. They are a policy failure. They are a funding failure. And above all, they are failure of will. So let's ensure that no woman dies giving life and no child is left to die from causes we know how to prevent. Thank you very much for joining us.
Well, Your Excellencies, ladies and gentlemen, on guests, we have come to the end of the program. As you've heard there, let us continue with the commitments that we've made, in particular, the partnerships across sectors that will help strengthen advocacy and accountability as per the commitments made through the Global Strategy for Women's, Children's and Adolescents' Health 2016 to 2030. Please have a drink, have something to eat, and continue the conversation. Thank you so much for coming to join us. Goodbye.